So our next session, we're going to welcome on stage a group of individuals going to address how to improve compliance and management in the healthcare facilities. They're going to give us insight about maximizing profitability, which is a driving factor, and speed, which is becoming more complex as healthcare facilities strive to deliver top quality patient care. So how do you satisfy those regulations while keeping compliant? Let's put our hands together as we invite Dr. Ajay up to the stage for the medical director from a urological hospital, Dr. Anish up to the stage, Dr. Sarah up to the stage, and it's going to be moderated by Shanawaz, Syed, the CEO of Bay Nation Health. I'll let you guys take it away. Come on up. I'll give everyone microphones. You got time on the clock. This is the last session before lunch, so we're going to have a hard stop at 12:30. Just for everybody, come on onto the stage. If you want questions, just be sure to manage the time, okay?
Hello, everyone. We are back again. All right, I'd like to introduce our panelists. We have Dr. Ajay, Dr. Anish, Dr. Sarah, and Dr. Bharath. And me as a moderator, Shanawaz Syed. I represent Bay Nation Home Health, based out of San Francisco. So we are here to talk about the topic which I believe nobody likes to hear: compliance, regulatory rules, regulations. But the good thing is that we are going to talk how to improve the compliance in our healthcare facility, you name it, clinic, hospital, healthcare, any healthcare facility. All right, I would like my panelists to introduce themselves quickly, and then we can move forward from there.
Dr. Sarah, you can go ahead, introduce.
As the only lady in this panel.
Only lady, Sarah, Dr. Sarah, please go ahead.
I'm Dr. Sarah Mandalawi. I'm the school doctor and medical director at Barsha National School. I'm a general physician as well and the co-founder of Telemedicine Clinic in University of Sharjah. I'm based in Dubai.
Dr. Bharath, I just introduced myself as the director and chief orthopedic surgeon of Mithra Multispeciality Hospital in Bangalore.
I'm Dr. Ajay Gangoli. Is this going? I'm Dr. Ajay Gangoli. I'm the director of Muljibhai Patel Urological Hospital in Nadyad in Gujarat. 2 decades of experience in the armed forces, and then 10 years in various hospitals in Bombay, Hyderabad, and now in Gujarat.
Hello, I'm Dr. Anish Varughese. I'm from Kuwait. I'm the corporate director of Dhaman Health Assurance Hospitals Company. We are a new HMO company that is based in Kuwait. We are going to cater healthcare facilities and services in primary and secondary care to 1.8 billion expatriate community in Kuwait. So this is our mission. We are now on a private model and we will be going live by March 2023.
Awesome. Well, to start with, I'd like to throw a question to Dr. Anish. All right, Dr. Anish, what is your general view on compliance and the management?
It's a good point. To me, compliance in healthcare is a set of laws, is how an organization follows laws, regulations, and certain other parameters that pertain to the healthcare industry. There are various compliance aspects that cover, which is internal and external in the organizations. But most of the compliance issues really lies in key 2 or 3 areas. So I'll say like it is mainly the patient safety, Second will be the safety and security aspects of the patient information. And next, it will be in the billing process. To me, I really stress on 4 areas where the compliance have to be strengthened. There are many views, there are many thoughts, there are many school of thinking, where are these compliance have to be strengthened. So to me, it's like effective care management. That is one area where exactly we have to be strong in a compliance. So that's where the healthcare is to be. Second, the holistic approach of care. This is also another area where the compliance have to be strengthened. Again, patient safety and clinical effectiveness is one of the area, and then the data-driven care coordinations. Once we, strengthen these 4 areas, automatically it reduces the risk in a healthcare setup, and it really make a culture-driven society or a culture-driven healthcare which can dwell much better. This is my view.
Great, Dr. Anish. You made a very quite strong point here. So, as everybody is aware that compliance means, like in my very simple statement or word, I can say a code of conduct for as a healthcare professionals, where we have to work. For example, if we have a patient, they are not just a patient for us. They're going to have some sort of, mind, body, and soul connection. That's where we have to make sure that we abide by the regulatory, guidelines, especially. That's what we call it, compliance. All right, so my next question goes to Dr. Ajay. What is your thought on medical legal infrastructure and compliance, Dr. Ajay?
Healthcare organizations, they're very complex. It's a very complex environment, and we do need to be aware that some sort of guideline has been existing in healthcare for centuries. We've had Sushruta, who's actually given us a code on how doctors should conduct themselves. We had a code of Hanubi, and in modern healthcare, actually, the first organization which came up was the American College of Surgeons, which laid down guidelines for how an operating room should be designed. Since then, of course, we've gone very far ahead. Medico-legally and infrastructure-wise, obviously, there's a lot of thought which has gone into how to make this safer for both the patients and the care providers.
Absolutely.
So from an infrastructure standpoint, things are designed with patient safety in view. You're looking at infection control, we're looking at preventing falls, injuries to the patient, injuries to the caregivers who give them, and things right down to guidelines for the way lighting is designed, for the way air conditioning or environmental control with air changes is designed, the kind of materials that are used which make sure that spread of microbes from one organization or fomite to the patient is restrained. There's a lot of thought, and I think healthcare organizations should understand that at the end of the day, all this just makes the entire environment safer for themselves and for the patients concerned.
Awesome. Very nice, precise answer from Dr. Ajay. All right, Dr. Bharath, what is your perspective when it comes to compliance in a hospital, like, in a big facility where I can say public care, for example, public health hospitals, where we have tremendous amount of patients coming and going out on a daily basis?
There are two things on this. One is the compliance of the hospital to the legal parameters, that is, which are assigned by the government for you to follow. Second is the patient compliance to the doctor's treatment protocol. Now, when you're coming to the hospital compliance to the rules there are a lot of loopholes. So there are a lot of ifs and buts. So it's important for an organization to try and maintain the optimum level of compliance such that there are no fallbacks. Because if there are any setbacks in the compliance, then like how Dr. Ajay said, we will have medical legal implications. So that is from the hospital perspective, whether it involves a lab, whether it involves a radiology setup, or whether it involves a medical record setup also. Like you have a medical legal case, you have the medical legal record should be well maintained, for which a country like India has the NABH and the NABL criteria. But the question is, in a large paradigm, in a large country like India, where you're having so many setups, where so many minor hospitals and moderate hospitals, small scale and big scale hospitals are setting up, how many of them are really going to fall in line? And how are you going to enforce it? So, like you're saying, the IRDA.
Especially, sorry to interrupt you, especially with the developing countries, we
Yes.
might have this. This is a serious issue
Serious
where,
issue.
yeah.
Yeah, so that's why the IRDA now has come out with a specific criteria that if you want to continue with the insurance policy, you have to finish in by 2 years. You should have had at least one certification, whether it's an ISO certification or NABH certification, which I think is the first step which India has taken in a way to bring in compliance into the organizations. Now, the second part of it, the patient compliance to the doctors, that's a totally different scenario. I think we can go on and on discussing, because I'm sure Dr. Ajay will understand the way how we have an urban setup to a town setup to a village setup, how the compliance completely varies from patient to the doctors at all.
That's
So-
absolutely correct, Dr. Raj. So, as Dr. Sarah, she mostly, you work mostly with kids, as I understand now. So, it is again a situation where, you know, sometimes it gets funny as well as sometimes it gets serious, you know, being with kids. How do you see when it comes to patient compliance improvement?
In a school, as being part of GYM's education, this very important and large organization, we have set of policies and procedures that are based on an online system that everyone can access it. But before I go into this, I want to touch on how important compliance is, as you kindly mentioned. It's for our patients to preserve their rights, but also to preserve our rights as well as doctors. Under the umbrella of Dubai Health Authority, I strictly follow the regulations that are set upon me and upon the school. Since I joined in 2021, the COVID era and the close contact tracing on all this dilemma, you need to be strict, developing and implementing those policies, making sure that everyone is aware of it, which is a challenge for me, as well as you have mentioned, I work with students, and it's not an easy job to monitor 1,100 students with chronic medical issues like diabetes, like hypertension, like nephrotic syndromes, all range. I've seen it all in the school. So you need to be careful to obtain those medical forms, the parents' consent, chase them, follow them up, implement the action plan, and try to be as, I'll say, you need to be strict, but at the same time, you need to be flexible, of course, depending on the situation. But when it comes to health and safety, they know me. I have zero toleration to breaking those rules, because my students' health is number one for me and for the organization as well. So how do we implement that? We have regular online training sessions that you receive an email at the beginning of the term. You do the online training. It's health and safety, everything about health and safety, including COVID. And then you go through an assessment If you pass that assessment, you get that certificate. If you don't, you need to repeat it. And if you don't do that training, you'll get a first reminder. Then you get a warning, and then you need to follow up with those staff and those members who doesn't comply with the regulations. Because we're talking here about safety of students and safety of staff members, and it's never a boring day in school, to be honest with you. When I first signed up, I thought it's gonna be a chill job. No, it's never been a boring day in school. I've seen it all, from emergency to just simple first aid care. But you need to have a compliance plan. As a policy developer, I managed to work with my senior leadership team to implement health and safety policy. For example, if a child has a severe allergy and he needs an EpiPen, the teacher needs to know how to deal with that student when they go on a trip. So I give them a checklist, they need to read it, sign it, and learn how to use an EpiPen, and then I send them on a trip. No student is allowed to go on a trip without an EpiPen if he has a severe allergy. So it's been a headache to follow up and try to keep people on track, but I like it. It's a challenge and I like it. So yeah. Nobody likes rules, unfortunately.
Let the conversation go on. I think Dr. Raj would like to add up something on that.
How do you follow the compliance in your institution?
Yeah, that's a very good point. Actually, so back in US, especially in California, we have a situation or system where we have to follow 3 different compliance bodies. First goes to federal compliance, which we call it Medicare. Second, we have to follow the state compliance, where our facility is located. And third, the accreditation body. So we have 3 different accreditation body in US. One is Joint Commission. I'm sure everybody is aware of it. And then we have second ACHC, which is American Home Care accreditation body. And then we have CHAPS. So these 3 accreditation, without this, their accreditation, where they have to, vouch for our policies and procedures, what we create, they come and they read line by line. And then once they approve it, then only we are called an accreditation organization, and we are allowed to enroll ourselves with Medicare program, which is federally government program. So that being said, when it comes to compliance, of course, we start with policies and procedures. Then we have different components to it, emergency management, and we have so many log files, fall logs, medication logs, I'll give you one instance. What happened, a very, very, very interesting story I'd like to share with you guys, what happened with us. And, it was an ordinary day. We got a call, and that call, I never want to attend that call. That call is from law enforcement department. The one law enforcement officer was behind the call, and he wanted to talk to me. Then my secretary came running, and she said that, yeah, there is a cop calling us. Okay, so yeah, I took the call, and then he was telling us, yeah, there's a complaint against your organization, and you have to come by tomorrow morning. Then I asked him, what is the nature of the complaint? And he said, no, we cannot discuss over the phone. You have to come personally to the police station. Then, yeah, that night I couldn't sleep because I was stressed, for sure. I don't know, I didn't know what's going on. So I thought that maybe they'll put me in a jail or something. But somehow, I went next day morning, of course, without my attorney. I didn't involve my attorney yet because I would like to know what's going on. Then the officer was very nice, and then he told me that there is a complaint, and serious complaint, from one of your patient's family, actually. Then I asked him, what is the complaint? I would like to know the nature of the complaint, and I would like to have a copy of that complaint, and he gave me. because they're in US, yeah, they have to present the copy of the complaint to the accused or whatnot. Then what I saw, that complaint is from one of our patient's son, and her mom died 2 days ago. And she was our patient. And we used to go and take care of her at home, you know. We used to send nurses, therapists, and all that. So I was surprised and shocked, and I was literally, you know, shaking. And then I came directly to my office, and I started discussing with my director of nursing. Then she said, yeah, she was also surprised because the family never informed us that the person is so sick, because she was having some sort of hyperventilation, and you know, her heartbeat was so high, so on. So somehow she died with a stroke. Because then what I realized, I asked them, are we in compliance with this patient? Then my director of nursing said, yes, we are in compliance. Then we have been through the log files, you know, how we chase them back. And then, so that day, let's say that she died 2 days ago, like before 2 days to that, we got a call from the family. They are saying that my mom is sick, so on and so forth. So we advised them what to do, you know, to prevent that situation. And then our nurse went there, and they didn't open the door. They didn't allow our nurse to get in, because I don't know, for some reason they were literally like, you know, going bonkers or crazy. So somehow we made a note, and then we called the doctor. The communication line was all like, you know, active. And then suddenly we've been following them every hour, every 2 hours, and then they stopped picking our call. And those things, every you know, communication, every activity has been noted in our log files. And the log files was necessary to keep ourselves in compliance. Whatever activity is going on around surrounding our patients, surrounding our nurses, so on and so forth. So we submitted our log files immediately to the police station, that we chase them, we follow them, and we never leave our patient behind, you know. We never leave our patient alone. But somehow they agreed to it. We could able to convince the officers or the police department that we did whatever the best we can do. So what I'm trying to say here is, if we wouldn't be in compliance, we would be like, you know, blacklisted. And as a CEO or as a head of the company, I'll be in a jail, because in US, the laws are very stringent. So, as you said, compliance and policies and procedures, and plus, those things are not permanently. You just write the policies and procedures, you just follow it. No, everything has to be checked, everything has to be reviewed at least once a year, annually, and update it according to the environment, according to the government rules and regulations. Because for example, post-pandemic, the whole scenario of healthcare system was different. Then pre-pandemic was totally different. So what I'm trying to say is, yeah, policies and procedures are very important, and you have to keep abreast of whatever is coming out from the government and from accreditation body.
Talking of various organizations, actually it is very interesting how the world is coming closer to common global standard. So the amazing thing is, we all aware of the various accreditation bodies all over the world, and based on that, of course, the International Society for Quality of Health has come up, and I think about 170 countries have now signed up. The patient compliance modules are across the world are extremely similar.
I couldn't agree more on that.
What differs is a little bit on the infrastructure and, of course, other criminal and labor HR rules that vary a little from country to country. So we are likely to reach, I think, at some point in the future where the patient compliance is likely to come under a common global platform and may be applicable everywhere.
Absolutely, you are very much true, Dr. Ajay. So my next question goes to Dr. Anish. What do you feel about consistency in compliance? Or do you feel any issues when it comes to consistency? And then how to tackle them, if you find anything?
Of course. See, in compliance structure in a hospital or in a medical center, one of the main issue is consistency. I mean, like most of the centers have compliance programs, they have regulatory bodies, but the main thing is like we don't have a consistency, at least to some centers. So implementing a consistent hospital compliance program is a key to cultivate compliance. This reduces and minimize the risk so that the real healthcare providers can, focus on the high quality value of care. How to bring consistency? This is another factor. I mean, like it can be brought in different manner. It can be implemented in different ways. One of the thing that I see is that we have to create and establish a multidisciplinary committee. A multidisciplinary committee, why I say that, because in most of the corporate hospitals, most of big time medical centers, they are having a chief compliance officer or a medical officer responsible for that, and they do the stuff with one or two assistants. It's not having a, a real engagement. So what I recommend and what I feel is like we should have representation from C-suite, we should have representation from nursing, and we should have representation from multidisciplinary other, links to this committee. Second thing is like written policies and procedures and schedules have to be there. Again, another factor how to implement the consistency is to have to perform an internal audit on compliance. Internal audit on compliance is happening in centers, but I really recommend to have a third-party compliance audit at least once in a year. Why? And we should not limit it to only clinical. We have to extend it to billing, we have to extend it to claims, and we have to extend it to other workflows. This will identify high risk areas. This will identify workflow inefficiency. This is how audit help compliance. Another factor of implementing a good compliance program is that we should have a robust education and training program within the groups. Most of the organizations see it as a burden, see it as a cost, see it as a waste of time. But when we look, and if our motto is to have a quality-driven healthcare, then a robust training and education is required. Main factor, main thing, we have to have a system to measure the program of compliance, program of performance. So by all those 3 to 4 items, I think we can implement a consistency in the healthcare.
Absolutely. I totally agree with Dr. Anish. So I'd like to throw one last question for Dr. Sarah. What do you think? How do you improve the compliance overall?
Like in general, I think I've noticed that lack of oversight, as you mentioned, like if you don't have that watchdog, the person that follows up and makes sure that everything is in place and everyone is compliant, they're reading their policies, they're managing, they're implementing it. So lack of oversight, we need to have someone. In our school, they have me, they have the manager of school operations. I am a part of a health and safety team and safeguarding team. We sit and discuss every month how we can improve compliance of teachers and students and parents as well. I've also noticed that people don't like to read emails or long emails and policies and procedures. So nobody likes them, including me. Including me. So I think we should keep it fun. We should keep it interactive, as I mentioned, in interactive videos, interactive training sessions that people can engage. And this is what I'm trying to do recently. I conduct workshops training workshops for the teachers, because they need to learn how to react to any emergency until I come into the scene, or if I wasn't there, like in the trip, they need to learn how to deal with an emergency, even being a non-healthcare provider. So we have to simplify everything and make sure that they are aware. For example, I recently created a system with the help of my IT team. It's called Phoenix. You put all the medical information of those students on the system. The teacher can log into the account with a click of a hand, and they get all the medical information and all the advices that I should put in action taken. So now it's more easier for them to know what health condition they are dealing with the training and with the oversight. I hope that we can get to a point that everyone is compliant.
Awesome, awesome, love it. So I think with this, we have come to the conclusion of our session. From audience, if we are open for the questions, if you have any, please come forward.
I think our audience first, let's put a round of applause for this panel discussion, a great one around compliance, addressing a lot of concerns that I'm sure you're thinking about in the back of your head. We had so many experts on the stage. I think people are getting hungry probably. Anyone have any questions they want to raise?
Oh,
I invite you to at the mic.
Or you guys can catch up with us
At lunch,
at
right?
lunch.
It's a great time to
That'd
meet with
be
these
great.
guys.
Yes. Thank you so much for your
Thank you.
patience and listening to us, with patiently. Thank you.
Thank you for our online audience. Thank you again. Great panel. Shanawaz, thank you for being that moderator. Everyone stand up on the front of the stage if you don't mind. Babu, please take a picture of these fabulous healthcare professionals. All right. Would anyone like to help me here? We have a request for a photographer. I hope you guys have found that extremely informative, and that's what we're doing here at Health 2.0, providing the latest, greatest, most up-to-date information for health professionals in the industry globally. Thank you again, guys. Thank you very, very much. I see you doing an absolute incredible job, not only connecting, also sharing that hashtag Health2Conf, C-O-N-F, is exactly how you're going to be recognized. I've said it again, and I'll say it again. Google, if you type your name in Google, you are who Google says you are. So by using that hashtag, you can actually, your profile on LinkedIn will be one of the first ones to pop up, and people can find you by the relevant topics that have been shared today. Hashtag compliance, something really popular and trending right now. So some of these key words are really informative and easy way for people to find the professionals in the industry that help solve solutions for these very big challenges that exist in our industry today. It's been a delight to have you here for day 3, morning session of Health 2.0. I'm going to invite you to join me downstairs for the final buffet lunch that the Intercontinental Festival City has for you for the final day, day 3. It's been incredible. If you have any questions, do let me know. Rachel Muleman at askrachel.info is how you find me if you need to get in touch. But I do invite you to use this time, the remaining time of today, very, very smart. Connect with everyone that you possibly can. I'm looking for the gentleman that raised his hand earlier that looked for more connections, but it looked like he left the room. So I'm going to find him when he gets back, and we're going to find out who he is and the value he brings to this industry. Have a great lunch. I'll see you after. We're going to have a hard start time at 1:30 to begin the afternoon session. We have a whole bunch to talk about, pharmaceutical companies, and we have a panel that we are very excited about, digital explosion in pharma. So it's happening here, and we're discussing it. 1:30. I'll see you back there. Health 2.0, day 3. Have a good lunch.